Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to try to help you decide if you're in preterm labor. Now, this is just a general set of guidelines. Again, when in doubt, you need to ask for help because only someone speaking to you directly who knows your medical history can give you the best answers to know what applies for you. But we can give you a few general tips that can be of help. The really important time to be attuned to this is between 24 and 37 weeks. And so one principle that you should understand is if you're dehydrated, you haven't had enough to drink recently, that will increase your chance of having early contractions. In fact, if you do come in and we are evaluating you for preterm labor, one of the first things we do is give you fluids. You might end up needing IV fluids, and that remedies a lot of the early contractions. So if you are having early contractions, or you think you might be in preterm labor, think, when's the last time I had a drink? When's the last time I went to the bathroom? When you do urinate, is it dark yellow or is it really light? If it's dark yellow, that's an indication of dehydration, not drinking enough. If it's almost clear, then that goes with hydration. We encourage you to urinate every hour to 2 hours and be alert of that. So some professions, like being a teacher or a busy employee working a lot, you unconsciously drink a little less so that you don't have to go urinate very often, but that can cause some contractions. So the other thing to try to sort out is, are the discomfort, the pains I'm having contractions, or are they just pregnancy pains like gas pains, or are they what's called round ligament pains, where as your uterus stretches it causes discomfort, or is it just back pain? So to help you sort it out, you should know that the uterus is a muscle, and just like any muscle, it can only contract for so long before it gets tired. And so that's what tells you that a contraction lasts about a minute, give or take 30 seconds, and not for 10 minutes or 20 minutes. They can come and go, so you want to watch for that. But if you feel your whole belly tightening up, feel it. It'll feel firm, and then if it gets soft after a minute, that's more likely contraction than just a soft belly, but a pain that just stays and stays, perhaps after you ate a food that might cause more gas. Gas pains are common in pregnancy, so the intermittent quality of the discomfort is a hint that it's a contraction and not just a discomfort in pregnancy. Also, are you getting discharge with it? Are you getting increasing discharge or bleeding? Or perhaps you just had intercourse, which can cause some contractions, drink some fluids, and that usually goes away after a few hours. But if it doesn't, that might be a time. If you continue to have contractions, you take some measures, you drink some fluids, you lay down, you make sure that you have enough food in you so you're not low blood sugar, and you're still having them, that might be the time to get some help. You also need to tailor your level of concern based upon your own risk factors. Do you have twins? That's a higher risk factor. Have you had this problem before? Have you had a recent infection? Is that a possibility for you? Have you had a procedure done on your cervix, like something called a LEAP or a cryo for an abnormal pap smear? There's a lot of variables which you have to take into consideration. And that's why if these brief measures don't work, you need to contact your team, your support team, your physician, your nurse, and to help you sort through whether or not you're in preterm labor. I hope you found this helpful, this general set of guidelines, and please leave your comments. Thank you.